In this lesson, you'll learn what prior authorizations are and what kind of services require them. This will help you get healthcare at the lowest cost. At Wellfleet, we strive to ensure that student members like you receive the right care at the right price and to their satisfaction. We call that the triple aim. There are several reasons you may need to seek care, from routine or diagnostic testing to emergency care. It's important that you know what your financial responsibility will be, as well as if you need to seek approval from the health insurance plan before proceeding with your service. Knowing this could save you lots of time and money and ensure you're receiving appropriate care. Most Wellfleet student plans will cover routine visits with only a copay. However, a prior approval, also called pre-certification, is required for inpatient hospital services, surgery, and selected outpatient services. Prior authorization verifies whether a specific service is medically necessary and appropriate, which helps ensure the best health outcomes for students. When talking to your medical provider about necessary procedures, discuss whether prior authorization is needed. If it is, your provider will send Wellfleet a request for prior authorization, including all the necessary medical information and why they believe the service is necessary. After reviewing the service being requested, if we believe this service is the best course of action, we will authorize it. Getting prior authorization adds a layer of assurance that you're receiving the right care while also helping you avoid delays and costly overcharges. Prior authorization standards differ based on whether you see an in-network or out-of-network provider. If you use an in-network provider, that provider is responsible for getting any prior authorization, and you will not be held responsible for lack of prior authorization. However, if you use an out-of-network provider, you can also be held responsible as well as the provider for failing to get the prior authorization. If there is no prior authorization with an out-of-network provider, you may be held responsible for the entire cost by the provider. It's important to note that prior authorization is not required for hospital stays for initial maternity care or an emergency or life-threatening medical condition, like a heart attack or compound fracture. Prior approval may be necessary for extended maternity care after the initial 2 to 3 days in the hospital. Additionally, no prior authorization is necessary for obstetrical or gynecological care provided by in-network providers. Now that you know how prior authorization works, continue watching to learn more about your student health coverage.